international multi-center clinical trials in age-related macular degeneration, retinal vascular disease, and vitreoretinal disorders. He lectures widely on retina topics, having delivered over 20 named lectures and more than 240 invited talks nationally and internationally. He has authored or co-authored nearly 250 peer-reviewed papers and book chapters. Dr. Johnson has received U.S. Presidential Scholar Award, the Senior Achievement Honor Award, and Life Achievement Honor Award from the American Academy of Ophthalmology, and the Heath Gottman Award from the Society of Heath Fellows. He has served as president of both the Macular Society and the Retina Society, and as director of the American Academy of Ophthalmology Retina Subspecialty Day. Mark is going to speak on compassion today, and as you all know, compassion is in our core, and it's an integral part of who we are and what we do every day. But it's important to know what is more about compassion. Is there a science about compassion, and how we can cultivate compassion? So we cannot wait to hear from Mark. Mark, thank you for being here.
Thank you, Hakan, for that. Turn this on. Thank you for that very kind introduction. It's a real pleasure for me to be here today. Even though I work at the same institution, we rarely have opportunity to visit other units within the institution. It's really nice to see the wonderful Cardiovascular Center and your beautiful auditorium. Real pleasure to be here. I want to thank Hakan for inviting me to talk about this. This has become, I'm not an expert. I want to make clear from the beginning that I'm not an expert on compassion, either in the way I behave or in my knowledge, but I became interested in this topic, and I like to talk about it whenever the opportunity arises, because I really believe that it makes a difference, not only for our patients and for our healthcare systems, but for us as individuals. So let's get into it. I don't have any financial interests relative to this topic. So we're in an auditorium where I suspect you talk about heart disease with some regularity, but there may be other matters of the heart that are less commonly discussed. And it occurred to me some time ago that in over 30 years of attending scientific meetings, I've never heard a talk on compassion. And that is, I think, quite remarkable for two reasons. One is that most of us chose to go into medicine out of a desire to help people suffering from disease. And yet we don't talk about this with any frequency at all. And the second is that there is, as Hakan alluded to, there is now robust scientific evidence that demonstrates that compassion on the part of healthcare providers measurably improves patient outcomes, enhances the quality and safety of healthcare, even improves financial margins, and importantly, also prevents provider burnout. So that data is out there. I came across it and was sort of seized with a desire to at least disseminate this within my department and as widely as I could across the ophthalmology community, and now making a little foray outside of ophthalmology. So this is the book that sparked my interest in this. And one of the objectives today then is to try to summarize briefly the evidence that compassion makes a measurable difference. This book is a systematic review of the world's literature on the effect of compassion on health and healthcare. The authors review over 1,250 papers and abstracts, and it's a real eye-opener because I really had no clue that this data existed. And then secondly, I'd like to spend at least a little time, again, acknowledging that I'm not an expert, and discuss ways that we individually can grow our compassion and communicate it to our patients. And I will say that this is an ongoing journey for me, but seeing the evidence has certainly motivated me to learn how to do it better and more consistently in my own practice. And I hope to give you that same motivation. So compassion can be regarded as an urgent necessity. Some of our greatest leaders have addressed this. Dr. Martin Luther King Jr. said life's most urgent question is, what are you doing for others? The Dalai Lama said, love and compassion are necessities, not luxuries. Without them, humanity cannot survive. So I think it's always good to start with the basics and define our terms. Etymologically, compassion derives from the Latin words meaning to suffer with, and it can be defined, this is my own definition after looking at a lot of other people's, the awareness of an emotional response to pain or suffering, coupled with an authentic desire and intention to alleviate it. So it has those two components, the awareness, the empathy, and then a desire to do something about it. So we can draw distinctions between empathy and compassion. Empathy involves recognizing and mirroring another's emotions, as in I feel your pain. And feeling empathy is a necessary prerequisite to compassion. But it's important to know, and this will come to bear as we talk about the neurophysiology of compassion. Compassion goes further and involves desiring or intending to take action. Now, if we look at the neuroscience underpinnings of empathy and compassion, on functional MRI imaging, feelings of empathy light up the brain's pain centers, whereas intentions of compassion, or the desire to alleviate another's suffering, light up reward pathways that are associated with affiliation, mediated primarily by oxytocin, and positive emotions such as mediated by things like endorphins and dopamine. So we can draw, again, distinction. Empathy is a feeling. Compassion is a feeling plus action. Empathy can be painful for us, whereas compassion is a healing experience, and we usually experience it as a rewarding and positive experience. So before talking about the proven benefits of compassion, I'd like to briefly outline the evidence for the fact that we really live in a compassion crisis. We can talk about the lines of evidence that there is decreasing compassion in society, first of all. For example, a study from University of Michigan showed a 40% drop in empathy scores between the years of 1979 and 2009. A Harvard study of high school students found that 2/3 felt that their parents do not value caring for others as much as they value achievement. A Pew Research Center study showed that 1/3 of all Americans don't include compassion among their core values, which I found a little bit alarming. And only 7% said that helping people gives them meaning in life. I don't have to remind this group, especially on the heels of our election, that we live in a time of growing political tribalism, which decreases our ability to see others' humanity and allows us to see other people as unreal or even less than human. And that is that's a factor that severely undermines our compassion for them. We can also talk about the evidence for a lack of compassion in healthcare. A Harvard study in 2011 showed that half of Americans believe the US healthcare system is not compassionate. A Mayo Clinic study showed that 35% of physicians manifest high levels of depersonalization. Another Mayo Clinic study showed that the time to first interruption of the patient by a physician interviewing them is a mere 11 seconds. And numerous studies have shown that physicians miss between 60 and 90% of opportunities to respond to patients with compassion. A Johns Hopkins study found that in 74% of interactions in the ICU, providers showed zero compassionate behaviors. And a systematic review found that, and this was, again, concerning to me, that empathy declines among medical trainees in proportion to the number of years of medical school and residency. So they start idealistic and compassionate, and then we drill it out of them somehow. Now, if we have a compassion crisis, why has this happened? I think we can talk about both individual factors and systemic factors. So under individual factors, certainly it's very possible to be skeptical that compassion makes a difference. So we just sort of ignore it and say, I don't have time for that. We can view it as a luxury rather than an essential component of our clinical care. we may lack the skills to consistently practice compassion. There is a human tendency to avoid or retreat from suffering because it's painful for us. Certainly, I'm sure all of us are very experienced with the idea that preoccupation while we're in clinic or wherever we are, preoccupation with our own personal stresses and worries makes us self-focused rather than other-focused. It's easy to judge our patients and blame them for their condition, which undermines compassion. It's easy to have psychological numbing in response to large-scale suffering. And then there's the very real factors of empathy, fatigue, and burnout. And when we feel emotionally exhausted, we feel incapable of caring. There are also, though, a host of organizational factors that can impede our ability to express compassion in healthcare. There are numerous bureaucratic, regulatory, and documentation burdens. The electronic medical record itself is an impediment. So we spend looking time at a screen instead of the patient, and that makes the patient feel unseen, unheard, and they may interpret that as a lack of caring and connection. High patient volumes and inefficient workflows leave us feeling like we have no time to express compassion. The institution may have an excessive focus on productivity. And sometimes there's an unfavorable organizational culture where bullying and cynicism or pejorative humor and reducing patients to cases is another factor that interferes. So with that background, the next question is, does compassion really matter? Is it worth our time to discuss this? I would say in a word, yes. And I think if any of you read the book Compassionomics, you'll probably come to the same conclusion. And this systematic literature review shows that compassion for patients is a highly effective therapy that actually changes outcomes for our patients. The authors of the systematic review grouped the mechanisms of action of compassion into 4 areas: physiological effects, psychological effects, enhanced patient self-care, and increased quality and safety of the healthcare system. Well, let's go through those and briefly summarize some of the findings. In terms of the physiological health benefits of compassion, we can first talk about the benefits of human connection in general. Because after all, if we're a physician having a compassionate interaction with our patient, we're also just a human being having a human connection with them. And there are numerous benefits of human connection that have been documented. A meta-analysis from University of Michigan showed that social relationships constitute a major risk factor for health, which is important as smoking, hypertension, lipids, obesity, physical inactivity, and other similar factors. A BYU meta-analysis found that meaningful relationships were associated with 50% higher odds of survival after major medical events. A Yale study showed that the lack of emotional support resulted in 3 times higher odds of death within 6 months of a myocardial infarction. The University of Chicago study found that loneliness was associated with 30% higher risk of coronary artery disease and stroke. And a Carnegie Mellon study found that social isolation reduces the immune response and resistance to viral infection. In terms of physiological health benefits, then or in terms of compassionate care from healthcare providers, here some of the benefits that have been shown in studies. And I'm not in listing these things. I'm simply listing the results. I'm not telling you how the studies were done, but these were done in a variety of ways. Many of these were randomized clinical trials where you have a compassion intervention versus sort of a regular intervention. So a variety of study techniques or study methodologies were used. So compassionate care from healthcare providers is known to increase parasympathetic activity and release oxytocin, which in turn lowers blood pressure and respiration and heart rates, and reduces inflammation and stress-mediated disease. Compassion can reduce perception of experimentally induced pain, or has been shown to reduce experimental pain by up to 50%, and has been shown to have similar magnitude effects on postoperative pain, back pain, headache, likely by releasing endogenous opioids. It's been shown to accelerate wound healing by decreasing levels of inflammatory cytokines that inhibit wound healing. It can speed recovery after heart attack and surgery. It's been shown to improve endocrine function, such that patients of high compassion physicians had 80% higher odds of optimal blood glucose control and 40% lower odds of serious diabetic complications. And finally, it can enhance immune function. It's been shown to reduce the duration of and severity of cold symptoms, for example, and increase interleukin-8 levels. In terms of psychological health benefits, compassionate encounters with providers alleviate anxiety and psychological stress associated with illness. One of my colleagues, for example, showed that vision-related anxiety and distress results in greater visual disability. So there's a certain level of vision loss. The greater the patient's anxiety and distress about that, the greater their disability resulting from that. So relieving patient stress can be enormously beneficial, and I don't have to mention that in a cardiovascular medicine auditorium. Compassionate encounters effectively raise patients' expectations for recovery, and this has been strongly associated with survival, for example, after coronary events. It's been shown to be highly effective in treating psychiatric conditions such as major depression, PTSD, psychotic disorders, and suicidal ideation. And importantly, it increases patient self-compassion and adherence to therapy. So we know that non-adherence to therapy is epidemic in our healthcare system. Patients with chronic disease fail to take medications as prescribed about half the time. And this has an enormous adverse impact on patient outcomes and survival. It's estimated to account for somewhere between $100 and $300 billion in avoidable healthcare costs annually in the United States. But care by a compassionate healthcare provider substantially increases the odds of adherence to treatment and screening protocols, and motivates and enhances patients' capacity to manage their illness. Now, it's been shown that compassion improves the quality of healthcare. So some studies have shown that a lack of compassion is associated with lower quality of care. For example, physicians scoring high versus low for depersonalization are up to 50% more likely to commit major medical errors, and 3 times more likely to commit major surgical errors. Compassionate care is associated, on the other hand, compassionate care is associated with increased quality of care through lower odds of major medical errors, 40% higher odds that prescribed treatment was consistent with best practices, and higher clinical competency scores among compassionate providers. Interestingly, compassion has been shown to drive revenue in healthcare. So the way this works is that higher patient experience scores are associated with higher financial margins, and hospitals with a compassion culture receive higher patient scores. Interestingly, and not surprisingly, in choosing physicians, patients value connection and caring over education, experience, wait time, cost, or any other factor you want to throw up there. For example, one survey found that 87% of patients said kindness is more important than any other consideration. Another survey, 85% of patients would choose compassion over pricing. A Harris poll of what patients thought were the most important physician qualities. 85% said treating me with dignity and respect. 84% listening carefully and being easy to talk to. And 81% truly caring about me. And that contrasts with only 58% who said having a lot of experience with my condition, which is a bit surprising, and only 27% who said that training at a top medical school is important. On the other hand, compassion, on the other side of the financial equation, compassion has been shown to cut costs. So compassionate, patient-centered care has the effect of reducing referrals, diagnostic testing, and office visits. For example, in one Canadian primary care study, referrals among compassionate, physicians who scored high for compassion, referrals were 59% lower and diagnostic testing was 84% lower. A UC Davis study showed that the median charges per patient were 51% lower. So compassion should be of great interest to folks who fund healthcare. It also reduces costs through better patient adherence, through reducing costly medical errors, and by lowering malpractice costs. And then finally, a culture of compassion in the workplace boosts productivity among providers and staff by cutting absenteeism and reducing burnout and turnover. Now, importantly for all of us who provide patient care, compassion has been shown to prevent physician burnout. And this shouldn't be too surprising. We know that physician burnout is a growing public health problem, estimated to cost the US healthcare system almost $5 billion annually. We know that dissatisfaction with the quality of patient relationships is associated with a 22-fold higher risk of burnout. And connecting with patients through compassion really transforms our experience in a way that builds resistance to burnout. I'm sure we've all experienced that. We know that compassionate action spikes endorphins and activates reward pathways, positive emotions, and affiliation. It promotes well-being, resilience, energy, and a sense of personal accomplishment, and reduces emotional exhaustion, depression, and burnout. It turns out that compassion training improves, just the training process itself improves emotion regulation, increasing calmness and positive affect and reducing burnout symptoms. So research confirms what a number of great thinkers have long told us. Again, the Dalai Lama, the first person to benefit from compassion is the one who feels it. Joan Halifax, many of us think that compassion drains us, but I promise you that it is something that truly enlivens us. And Ralph Waldo Emerson, it is one of the most beautiful compensations of life that no one can sincerely try to help another without helping themselves. So if we have no other reason to be interested in compassion than the fact that it's going to make us better and make us healthier, then that alone is a compelling reason. So that's a quick survey of some of the benefits that have been documented in a very extensive literature about the benefits of compassion in healthcare. And I'd like to move on and talk at least a little bit then about how we can deal with this as individuals. I think it's a key question. What if we don't feel like we were born with a lot of empathy and compassion? Is there anything we can do about it? And it turns out that the literature shows that compassionate behaviors can be learned, very similar to learning a musical instrument or a sport. And this functions via neuroplasticity, which says that the human brain is malleable, that we have the ability to shape our minds and rewire our brains through intentional practice. I would say intentional and repeated practice. So, for example, examples of this effect: London taxi drivers are found on scanning to have larger brain regions associated with spatial relations and spatial memory. Violinists are found to have more brain mass in areas controlling finger dexterity and so on. And it's been also shown that Tibetan monks, here's one with EKG leads, who are expert in loving kindness meditation, have markedly increased and synchronized gamma wave activity and more gray matter in regions involved in affect and emotion regulation. So again, repeated and intentional practice literally rewires and changes the shape and constitution of our brains. And so if we want to develop any skill or trait, it's really possible to do so, but it takes work. Meta-analyses of compassion training programs show that even a brief period of compassion training can lead to a measurable increase in compassion and acts of generosity. And 80% of studies of compassion training involving physicians have demonstrated measurable increases in compassion. So these are really on the whole quite effective. These are sort of some we're moving into sort of personal observations. I've been reading about compassion for a number of years, and these are my thoughts about how we might go about as individuals cultivating and practicing compassion in our own lives. I think first of all, whenever we're trying to acquire a new trait, it's important to prepare a fertile mind for that trait that we're trying to cultivate. So compassion can be best developed in a mind that's primed and prepared for compassion. I think this involves a number of steps. One is to attend to basic self-care. So it's hard to learn any trait if we don't have some degree of well-being. So healthy diet, adequate sleep, regular exercise, nurturing our own relationships, and maintaining some degree of work-life balance. And then I think just spending some time to learn about compassion from books, podcasts, websites. There's a huge world out there that's regularly discussing this topic. And then we can even expand empathy and compassion by hearing others' narratives. I've been very inspired by reading memoirs and biographies about people who've struggled with medical conditions, for example, or other hardship. And then just in general, reading literature and viewing film that puts us in the shoes of people who are different than us, can build our understanding and empathy. So having prepared a fertile mind, are there other steps we can take? Again, this is a little outside the scope of this, but for those that are interested, much of compassion can be cultivated through daily contemplative practices. We won't go into the details, but these come in several varieties. Mindfulness meditation can set the stage for this by enhancing intentional and emotional stability and reducing self-focus and mental rumination. So those are kind of prerequisites for having compassion. And this can be achieved by a regular mindfulness meditation practice. Then there is something called loving kindness or metta meditation, which strengthens those inclinations. And compassion is a natural response of a loving heart in the face of suffering. So having a loving heart is obviously important. There are specific compassion meditations, one of which is known as Tonglen. And brain studies in long-term practitioners show increased brain responses that are involved in resonance with others' emotions, downregulation of self-concern, and greater activity in neural circuitry for action. So after practicing this, we can make ourselves more eager and ready to help. Even awe training. There's a wonderful book on the benefits of awe in our lives. Even awe training has been shown to reduce symptoms of burnout and promote compassionate action. And then there are formal compassion training courses for healthcare professionals that are available both in person and online. I think so. Those are some of the ways that we can cultivate compassion. The desire to do this, I think, really arises from the recognition that medical practice is a sacred calling that is intrinsically, or should be, it is intrinsically joyful and fulfilling, and yet we sometimes don't experience it that way. But remembering that, I think, is important. And it also comes from the aspiration to selflessly serve our patients rather than serving ourselves. We can build on our Hippocratic oath to consecrate my life to the service of humanity and make a commitment to cultivate and grow our compassion. I think it's also important to consider it a duty to show compassion in every encounter. And it's a good reminder that we don't have to feel compassionate in order to respond with compassion. And then what's been really important for me is to set an intention each morning. And this takes, a few seconds, but just to take a second, whether it's walking out the door or attaching it to something I do every day, to set an intention, to serve the patients of that day with kindness, caring, and compassion. And that just sort of primes my brain to at least have the possibility of doing this when I'm in clinic. Now, the big problem for me, and I suspect for many of us, we may walk through the clinic door with all kinds of good intentions. And as soon as we see the patients and get behind it all and start to feel the stress of the day, it all kind of falls apart. So I've given some thought to how is there a way to actually do this when we're in clinic. And I think this little mnemonic is helpful to me. I know it's helpful to me whenever I remember to do it. We could see every patient encounter as an invitation to help. And so this mnemonic is our way to RSVP to that invitation. And the R stands for taking just a second to recall our intention. We've made this intention as we left the house in the morning. So at the beginning of each patient encounter, we use some action that we do with each patient, whether it's opening the exam door, sanitizing our hands, as a trigger to just bring to mind the intention that we made that morning. So that may be just repeating a silent mantra like, I'm here to give kindness and compassion. And that, again, gets us back into that frame of mind as we start to interact with the patient. The next is the S stands for taking a second to see the patient as a real human being with worries and fears. We can, smile and call them by name and really look them in the eye. So I often, when I'm speaking to ophthalmologists, I say that it's easy to examine a patient's eyes all day long and never really look them in the eye. And that's literally true. I spend all day looking at retinas, but I have to step back and really look them in the eye, see them as a person with fears and aspirations and so on. Obviously important to remember that we're treating a person, not a disease, and to remember that when we're fully present with someone, when we do take that second to see them as a person and we're really there with them, compassion arises pretty spontaneously. The V stands for validating their spoken or assumed fears. So that entails actually listening to them, first of all, taking a second to imagine what it would be like to be in their situation with these concerns about their heart or whatever the problem is, and then just expressing empathic validation. And again, none of these things take more than a second. Just saying something like, "This must be really hard for you," or I can imagine this is really frightening. And I've had the experience as I've started to do this a little bit more of having patients just break down in sobs because no one had ever really acknowledged before that what they were dealing with was frightening and difficult. And that kind of interaction then creates this new connection with the patient. And then finally, the P is to not forget to provide some kind of a compassion statement that expresses empathy, caring, and support. And this could be, whatever comes to mind, something like, "I know this is difficult for you and I wish you didn't have to face it, but I'm here for you and we'll get through this together." So some kind of just statement that, I understand and I'm going to help. These kinds of compassionate interactions certainly make patients feel seen and heard. They make them feel valued, respected, and cared for. And that then triggers all this positive physiology that we talked about that is actually of benefit to their health. These kinds of compassionate communications require only a few seconds, and yet they have measurable effects on patient anxiety and other patient physiology in randomized clinical trials. And I would say that in light of their proven effectiveness, such communications really should be considered an essential component of medical practice. And that, of course, requires clinical schedules that allow for at least a little time. So they don't take a lot of time, but it takes a little bit of time to listen and talk to our patients. James Doty is a neurosurgeon that some of you might have read his work. He established the Stanford Center for Compassionate something. I don't remember the title of it, but they research the effects of compassion. He said he made this statement that I found impressive. I learned that just by listening to my patients, just by giving them my time and attention and focus, they felt better. I acknowledged their struggles, their accomplishments, and their suffering, and in many cases, this relieved their pain more than any medicine or surgery I could offer. I believe my greatest success as a neurosurgeon is the result of caring with an open heart and being present with my patients. It's important to remember that sometimes compassion is all we have to offer. Patients with untreatable or incurable disease, or when we encounter these patients with incurable disease, it often induces panic, discomfort, or a sense of impotence in us. And for such patients, truly compassion is all we have. But unfortunately, it's easy to miss the opportunities. Frank Bruni is a wonderful columnist for the New York Times who developed an ischemic optic neuropathy and lost vision in one eye. And he wrote a wonderful memoir called The Beauty of Dusk. And in that, he said, I saw some of the best ophthalmologists in New York. Not one of them said to me, now that you've been told you might go blind, how are you doing emotionally and and psychologically? So, you know, a little bit of an indictment on my specialty. So although we can't control the outcome, we can attend to the patient with loving presence and show them we care, and this can be enormously helpful in helping the patient accept and be at peace with their condition. And that's sometimes all we can do is help them really, live with this in as constructive a way as possible. A patient with advanced lung cancer was quoted in the book that I referenced. Again and again, I have been touched by the smallest kind gestures, a squeeze of my hand, a gentle touch, a reassuring word. In some ways, these quiet acts of humanity have given more healing than high-dose radiation and chemotherapy. So in summary, compassion is the emotional response to another's pain or suffering, accompanied by a desire to alleviate the suffering. A systematic review of the world's literature shows that compassion in healthcare measurably improves physical and psychological patient outcomes, increases patient adherence to treatment plans, improves healthcare quality and safety, increases revenue and cuts costs, and prevents physician burnout. We reviewed the fact that compassion can be actively cultivated through intentional practice. And finally, compassion-infused communications with our patients require only seconds of time, but should be considered an essential component of effective treatment. And that's everything I know about this. So I'm happy to answer or discuss any questions or topics you want to talk about.
Thanks so much, Mark. Any questions for Dr. Johnson? It's a fantastic topic. Thanks so much.
Here you go.
Yeah, thank you. Thank you for coming over. We appreciate it. Do you have some practical examples of how you've woven this into your practice or your training programs at Kellogg?
Yeah, regrettably not. We other than talking about it, I mean, I've given this talk to our residents. I'm speaking this in a few weeks with our culture committee, and hopefully we'll be able to start doing something to actually make this more concrete. But so far, I've just been trying to raise awareness and motivate people to start cultivating their lives. But certainly, one of the things that we looked at in writing this paper was the fact that increasingly medical schools are, have a doctoring component where they're looking at these, maybe less medical aspects of of being a physician, and so I'm encouraged that this is most medical school curricula are now at least trying to include these kinds of things, but so far we have not taken the steps needed in ophthalmology.
It's really provocative. It's really, it's such an important topic. So our medical school and all around the country are so competitive. And I know in our interview process now, they're case-based scenarios. So rather than just talking to an interviewer, they're given a case or whatever. Do we have a way to examine compassion in a potential matriculant here? Because, maybe somebody's better value is they're highly compassionate and maybe they score less well on a test. Is there a way we could implement that in our selection of medical students?
Yeah, that's a fantastic question. I would guess there is. If we're asking them questions, it would be being intentional about asking questions that help to sort this out. And I would think, some of them might be case-based scenarios where you're presenting them with sort of we all have opportunities every day in our practice to respond to people with compassion, and it's easy to miss those. And I would assume you could design, case scenarios for medical students that would give them the opportunity to show their compassion. And I suppose it would have to be validated in some way, but even without validation, I think there are questions that could tease that out of people as to whether they're, whether it's a natural response for them to respond in a compassionate way or in a less compassionate fashion. But I think it's a wonderful concept.
First of all, fantastic talk, very mind-opening. You've showed us data that compassion helps patients, it helps physicians, it helps economics. So my question is, why is this not something that we're more aware of? Why is it's not something that we all know of? Is it lack of publicity? Because I think, we should all be embracing this, including the healthcare system, in a larger kind of scale.
Yeah, once again, a great question that I don't have the answer to. My response to reading the book was, wow, why didn't I know about this, and how can I help disseminate it? So this is my weak attempt to, at least within my field, to start this discussion. I gave a very short version of this talk at the American Academy of Ophthalmology last year. So it was the first time that, to my knowledge, that had ever been discussed in a forum where the talks tend to be all scientific. And I will say that it was extremely well received. I've spoken at this same forum every year for 25 years or so, and I may get some positive comments from people in the audience, but this was way out of proportion to anything I'd heard, any feedback I'd received about any other talk. So I think people are hungry for this. All of us are, we recognize that there's something very important. We resonated with it emotionally. There's something very important here. And I'm still kind of scratching my head about how to make this better known and how to incorporate it in our national discussion across all specialties about healthcare delivery. But you're right. I mean, if I'm a hospital administrator, I can't see anything in this that should dissuade me from wanting to do this, except that we have so many things to talk about. I guess it just doesn't rise to the top. I don't know if anyone here has any thoughts about why we don't talk about it more. I think it's considered to be sort of soft science, perhaps, and we like to deal with hard facts. But it's impressive the extent to, I think you started reading the book. It's extended to the way that these studies are done. They're I think very legitimate.
I was gonna comment about probably 15, 20 years ago. Yeah. So about 15, 20 years ago, I worked at St. Joe's, and I know there was a book that came out and
Stu Winston was our EP doctor over there, and he was a big proponent of it. And it was about physicians and bedside manner and about sitting down. I think the name was something like that, sitting at the bedside. And they implemented that across the entire institution where they actually had a department that implemented, bedside manner, compassion, and they actually had people come in with the physician in the hospital, and they actually watched them and do an interaction. If they had to pay, the doctor had to sit down at the bedside, had to kind of go over all these things, and someone gave them feedback. There was on an iPad, they went over all these different factors, and afterwards, they gave feedback to the physician to help improve that. And that was about 15, 20 years ago. So other institutions are doing it and have been talking about this. So I think it definitely something that, that we can start doing here.
Yeah, that's impressive.
Yeah. Yeah, there's a comment. This is Leanne Covenant. Compassion has been a long-standing focus in nursing. Perhaps this is an opportunity for medicine and nursing together. The comments.
Yeah, fantastic.
There, but it's important to focus on. And it probably is a dynamic process, what I will focus on. It's like a marathon, you have to keep building onto it and don't let that oscillate from day to day.
No, I think that's right. What I've learned in my struggle to try to become a more compassionate provider, and maybe that's not the best term. It's not so much, I don't think we're lacking, in general, we're not lacking in compassion. It's a core human value. It's within all of us. I think what I fall short on is really expressing that compassion to my patients in a way that they feel it and that it makes a difference for them. And that's because we all get sidetracked by whatever stress of the day. We're behind in clinic. We're worried about the patient's condition, how we're going to treat this. There's so much rumination that's filling our brains. And so what I'm learning through trying to do some of the daily contemplative type practice and really make this part of my mindset and to make it spontaneous and natural and ever present is that it takes a regular sort of daily effort. So regular practice, intentional practice, setting that intention, and then finding a way to remind myself of the intention all day long. So as many times as I've given this talk, and my wife is a psychotherapist, and so I discussed with her how do we, she was helpful in coming up with this mnemonic. How do you actualize something in your everyday life when you want to do it, but you keep getting waylaid by the reality of that, of your daily activities. And all I can say is that when I remember to do it, which may be if I see 30 patients in a day, I may remember to do this twice. But for those 2 times that I do it, it makes a real difference. It transforms my experience from obsessing about whatever it is I'm obsessing about to really being there with the patient, feeling that connection, having some of that really joy and reward come back into it. And I have no doubt it makes a difference for them. And like I mentioned, simple things like, when I'm in this frame of mind, I'm much more likely to detect something in them that tells me they're really worried about this, or even if they don't show me they're worried, I can assume that they're worried because I just told them they've got a disease that's going to take some of their vision. Just taking that second to say, I know this is really hard, and I'm sure this is very frightening to hear this, and I want to reassure you about such and such. And patients are enormously grateful when we take the second to make those kinds of statements. So can't remember how I got on this. Yeah, it's the point is it's not something we can talk about once, and no matter how much you might have liked this data, I guarantee it, if you go out and just hope that it changed your life, it won't. It becomes an effort on the part of each of us to really reshape our own brains.
I have one comment from Geoffrey Williams. Your talk is very consistent with writings of Eric Cassell, the nature of suffering and the field of positive psychology. I believe one of the issues relating to our loss of compassion through training is that training and practice environments do not support our psychological needs and tend not to show compassion for learners and practitioners. That was from Geoffrey Williams from our institution.
Yeah, absolutely. That's a very important observation. If we're in an environment where we ourselves don't feel safe and supported, then it's very difficult to be thinking outward, thinking of others. So it really, some of this, I mean, it has to be an individual effort, but there's a lot that can be done on the institutional level to create an environment that facilitates this and nurtures it. So great comment. That was certainly listed and among the impediments to compassion was, and I think I can't remember if I ended up including it, but having those institutional factors in place that show compassion and support the individual providers and trainees.
Mark, thank you. This was a fantastic talk. Thank you so much.
Thank you so much for having me. A lot of fun.